Chapter 26, Teaching and Learning in the Clinical Context. Lack of planning coupled with poor supervision and feedback often blights clinical teaching. Changing perceptions of clinical teaching. Clinical teaching focuses on real patients in clinical settings. The setting may be the hospital ward, outpatient department, surgical theater, or the community. Students enter medicine to become doctors, and learning with patients and for patients is a powerful and effective learning experience. It emphasizes a holistic approach to medical care, requiring from the student the necessary knowledge, skills, and attitudes. Clinical teaching should be at the heart of medical education, but how it is delivered is sadly often ignored. In earlier chapters, we have looked at the apprenticeship model, at the need for a more authentic curriculum based around patients, at interprofessional learning opportunities, and at the longitudinal clinical clerkships where students have continuity of learning over a period of up to a year in one clinical attachment. In postgraduate education, there is now recognition that the education of the trainee need not conflict with his or her service role in the delivery of healthcare. With an appropriate curriculum and planning, learning can be managed on the job in the context of the trainee's work. The key players in clinical teaching are the student, the teacher, and the patient. The coming together of a student enthusiastic to learn, a teacher passionate to teach, and a patient willing to contribute provides a powerful and rich learning opportunity for the student. Figure 26.1, Clinical Teaching. The student. The role of the student in the clinical setting varies depending on their seniority and stage in the curriculum. A junior student may actively engage in learning while not being a member of the team delivering the patient's care. Students may visit the ward in groups of 6 to 10 and be taught on one or more selected patients by an assigned clinical teacher. Students observe the teacher taking a patient's history or examining the patient and may have the opportunity to do so themselves. The students are then questioned on the findings and required to reflect on the patient's case. Feedback is given to the student. A more senior student participates in a clerkship as a member of the healthcare team. The teaching is integrated into the care of the patient. Students move from a peripheral role to one of participating as members of the medical community or practice. Students learn from working alongside experienced practitioners and other members of the healthcare team. In the process, they are socialized into the practice of medicine. The ward round and patient care conferences are typical learning opportunities. In postgraduate training, work-based learning is the norm, with trainees developing their competencies as junior members of the healthcare team with certain assigned responsibilities. Short training sessions relating to specialized aspects of the work or procedures can be scheduled. The teacher. The role of the clinical teacher is challenging. The teacher requires expertise in the area of medical practice, an understanding of how they can facilitate student learning, an awareness of the local curriculum and expected learning outcomes for the student, a recognition of their position as a role model for students. Junior and senior doctors, other healthcare professionals, and students can all contribute to the teaching program. The role of peer or near-peer teaching is described in Chapter 29. Table 26.1, The Attributes of a Clinical Teacher. Good clinical teacher plans the clinical teaching with clearly defined learning outcomes. Bad clinical teacher, opportunistic and haphazard approach with no clear plan. Good clinical teacher appears enthusiastic with a positive attitude. Bad clinical teacher, uninterested and regards the teaching as a chore or intrusion into other commitments. Good clinical teacher serves as a positive role model demonstrating good relationships with patients. Bad clinical teacher serves as a poor role model lacking aspects of professionalism in practice. Good clinical teacher helpful and available to students. Bad clinical teacher intimidating and teaches by humiliation. Good clinical teacher encourages students' active participation. Bad clinical teacher didactic with students' role passive. Good clinical teacher patient orientated with problem solving. Bad clinical teacher disease orientated and factual. Good clinical teacher observes students examining patient and provides feedback. Bad clinical teacher listens to or reads students' reports of examination of patient and provides inadequate feedback. Good clinical teacher provides students with opportunity to practice their skills. Bad clinical teacher does not encourage students to practice their skills. Good clinical teacher tailors the teaching to the stage of training of the students and to the needs of the individual students. Bad clinical teacher does not take into consideration the stage of training of the students or their individual needs. Many studies have explored the attributes of a good clinical teacher, and these are summarized in Table 26.1. The skills required of a clinical teacher too often have been taken for granted, and it has been assumed that if doctors are good practitioners, they are also good teachers. Unfortunately, this is often not the case, resulting in deficiencies and poor practice in clinical teaching. Problems identified include the lack of planning, inappropriate supervision, lack of feedback to the learner, and a failure to appreciate basic education principles and how students learn. The patient. The patient is a key element in clinical teaching and may be a hospital inpatient, outpatient, or may be located in the community. It is important to obtain full patient consent before students interact with patients, and it is important that patients' comfort and dignity are respected. In addition to learning with real patients, students can benefit from working with simulations, including simulated patients, mannequins, and computer representations, as described in Chapter 27. These tools can complement but not replace experience with real patients. They bring the real world into teaching, provide more authentic learning experiences, and help to ensure that the teaching is relevant. Patients as well as the teacher can provide feedback to the student about their techniques, attitude, and communication skills. The range of patients seen by students in a clinical attachment should reflect the expected learning outcomes. This can be recorded in a portfolio, and any gaps identified in a student's clinical experience should be remedied. Students who use an electronic handheld device to document their patient encounters produce a more complete record. Patients can be selected for clinical teaching on the basis of their presenting problems, their availability, and their willingness and ability to cooperate with students. Patients may actually feel they have benefited from the experience. Teaching procedural skills. Acquiring experience in procedural skills such as intravenous cannulation or stitching a wound is an essential learning outcome. It is important, particularly in the context of the increasing emphasis on patient safety. A 6-step framework for procedural training has been proposed. 1. Learn, acquire the necessary knowledge. 2. See, observe the procedure. 3. Practice, develop the skill on a simulator. 4. Prove, demonstrate mastery of the skill on a simulator. 5. Do, perform the procedure on a patient initially under supervision. 6. Maintain, continue clinical practice on patients and simulators to ensure there is not degradation of the skill. Student progression. In the traditional curriculum, clinical teaching took place in the later years following a study of the basic sciences in the earlier years. Now, clinical teaching in many medical schools starts from year one of the curriculum. Over the course of the curriculum, the clinical teaching assumes a more dominant role in the education program. The clinical experiences and attachments increase in length from a half day to weeks or months. Students have increasing responsibility for patients and are assigned roles in the workplace. This may be reflected in specified and trustable professional activities as described in Chapter 8. Planning and implementing. As with all teaching approaches, planning is important. The expected learning outcomes must be clearly defined and communicated to the student. These may include skills in history taking, mastery of practical procedures, and an understanding of ethical issues. Appropriate learning opportunities, both formal and informal, should be scheduled in the learner's work plan. Teachers responsible for a formal teaching session should make the necessary arrangements for the session and should arrange for someone to cover their other commitments so that they are not interrupted by bleeps or other calls. In a formal clinical teaching session, students should be actively involved and engaged. They should feel free to ask questions and ask for help if required. They should be encouraged to reflect and think about the patients they see. Students can be helped to do this by the use of skillful questioning by the teacher, the aim of which includes arousing the learner's interest, e.g., how often do you think a general practitioner will see a patient with a thyroid problem? Testing the learner's knowledge of the subject, e.g., is this a reliable indicator that the patient is hyperthyroid? Promoting the student's understanding and encouraging the student to reflect on the topic and stimulate their critical thinking, e.g., which of the treatment. Options available could you advise in this case and for what reason? Encouraging the learner to relate theory to practice, e.g., what is the explanation for the patient's tachycardia? Inviting comparisons or different viewpoints, e.g., what is different in this patient from the last patient we saw? Consolidating the learning through encouraging the trainee to review and summarize the learning that has occurred, e.g., what have you learned today from the experience? As a teacher, you need to learn to be comfortable with silence. Give the students at least 3-5 seconds to think between asking a question and expecting an answer. Insufficient attention is paid to the art of questioning in staff development programs. We have found the skill lacking even in experienced teachers. As well as questioning the learner, it is important for the teacher to be a good listener. You need to hear and understand what is being said and respond accordingly. Non-verbal behaviors are also important, so try to maintain eye contact with the student. Feedback is an essential part of the learning process, and in clinical teaching, the provision of feedback to the learner is of particular importance. It provides students and trainees with information about their performance and how they can improve upon it. It needs to be given skillfully if you want to motivate your students, and this is discussed further in Chapter 3. Clinical supervision. In postgraduate training programs, the trainee's clinical supervisor provides the trainee with guidance and feedback on matters of personal, professional, and educational development in the context of the provision of safe and appropriate patient care. Clinical supervision of the trainee is important, but how it is carried out is highly variable. The clinical supervisor is responsible for finding out the aspirations and career intentions of the trainee, recognizing the strengths and weaknesses of the trainee, and adapting the training to the trainee's needs. Meeting regularly with the trainee to discuss the expected learning outcomes. Monitoring the trainee's progress and giving frequent and constructive feedback. Encouraging the trainee to be reflective by keeping a diary or portfolio of the clinical cases encountered. Being available for the trainee when support or advice is required. offering counseling to the trainee if the need arises, keeping the trainee motivated by being positive themselves, keeping their personal knowledge base and practice up to date.